Hi, I'm Phaedra Cress with the Aesthetic Surgery Journal, and I'm standing in for Jason Rustine, who is the lead Next Generation editor. I'm here with Dr. Karen Leong. Welcome today, Dr. Leong.
Good morning. I'm Dr. Karen Leong, I'm one of the editors on the Next Generation editorial board, and I'm happy to be here today. I'm currently doing my fellowship with Dr. Dan Mills in Laguna Beach, and I'm happy to share with you about my experiences.
So, Dr. Leong, we met a year ago at the last ASAPS meeting, and you were about to go into your fellowship with Dr. Mills. So what we'd like to hear from you today is, how was your experience in fellowship? Would you recommend it to the next generation moving up behind you? And how did it help you to determine your path forward post-fellowship?
Okay, so I went into fellowship because I knew I was moving to Southern California, and I knew what a crazy market it is out here. And I wanted to get a step up and try to get to know the demographic and have some networking capabilities. So Dr. Mills was in the perfect position to do that. He was just president of ASAPS this past year, and I think it placed me in a very good position. So yes, this year has been worthwhile. I've gotten to see a lot of what they do in California, what the patients want that's different from the East Coast where I'm from. I've gotten to meet a lot of the people in the industry, and I think it's just given me a foot up for my next step going into private practice in this area. I would recommend an aesthetic fellowship. Some things are changing with the Board of Plastic Surgery in the next couple of years, so if you're interested in aesthetics, you should definitely look into doing a fellowship. But look early, like I said last year. This is getting hot.
Highly competitive, right?
Yes.
So now your trajectory is a little different than others. So instead of going into solo practice or just joining group practice, you're joining a practice with a dermatologist. So can you tell us who you're joining and how you sort of foresee melding your experience and expertise with hers?
Okay, yes, so I know that as a plastic surgeon, we've been trying so hard to protect our specialty, and I think that's so important. But part of projecting ourselves and making ourselves the eminent leaders in this field is that we do have to work with other specialties. And I think if we collaborate, we make ourselves stronger instead of standing alone. So I'm independent contracting with a dermatologist. Her name is Zena Gabriel in Newport Beach. Super excited. She's very energetic, enthusiastic, and we're just looking forward to working parallel to each other. She has a lot to offer that I may not know about, and I can cover things that she usually refers out to other area surgeons. And I think for me, being able to build this brand with another strong female is something that I'm so excited about. And I think in terms of collaboration, this is the way we have to go.
So this will be interesting. You mentioned referrals. So you can kind of keep these referrals in-house, you sending patients to her and vice versa. So could you talk a little bit more about what types of procedures you anticipate this might be relative to, so people who might want to follow in your footsteps could have a sense of that broader scope of the procedures and how that system might work?
Right. So I'm a young surgeon. I still have to take my oral boards. And part of what I wanted to do is I'm really interested in skin cancer reconstruction and Mohs. So I didn't want to give up that portion of my practice and just go pure aesthetic. And then again, I'm not really interested in breast reconstruction. So I thought working with a dermatologist would be a good mix because she has all the devices, she knows all the skin stuff. People see her on a month-to-month basis, and they tell her about their needs. So I'm anticipating, and when I talk to her, what we're looking at is probably a lot of facial procedures to begin with, and then once we build that trust, it can work its way down its body. Liposuction and liposculpturing, obviously, since there's so many non-surgical devices. And one division that we are starting together in our new med spot is a vaginal rejuvenation. So I know this is a topic that's been discussed a lot in the past few years, and there are specialists out there who keep presenting. And I think as a woman and as a female surgeon, I have a special affinity and a desire to talk to women about these intimate issues. We're seeing it more and more in social media, and we're seeing all these fruit references, but I'm thinking, if I were going to see someone to talk to about this subject with, I would want to speak to another woman. And who better than, say, a dermatologist who I'm seeing month to month for my facials or my acne, or laser hair removal to build and have this natural transition. So we are doing that together. We're going both non-surgical, and I'm offering the surgical services.
Well, it sounds fantastic. We wish you the best of luck. Congratulations on 1 month from now. You'll be completing your fellowship with Dr. Mills, the immediate past president of ASAPS. And best of luck, and we'll see you very soon.
Thank you, Phaedra.
Thank you.